Talking about death can change the direction of your life. I was working this weekend and I wanted to tell you the story of a patient and their family because I think it's so important. It's a great example about how talking about death can really change the direction of your life. So, I pull up this patient at my computer who I'm supposed to go see for palliative care admission. Palliative care, again, remember, is different than hospice, and I do have a video about this. When I started looking at the details of the patient, I saw that they were very elderly, late 90s, male, and I saw that they were full code, which means if their heart were to stop, you would do compressions, be put on machines to try to keep them alive. Now, someone can be full code if they want to. However, for someone who is in their late 90s, this is something that I could tell. I was thinking in my head, like, why hasn't someone talk to this patient and their family about this person not wanting to be full code? Because it's a very violent thing that really only young people who are in pretty good health should be a full code. Everyone else, in my opinion, generally speaking, should not be, because the outcomes aren't good and you usually don't survive anyway. It just prolongs and causes more suffering. So that's the first thing I thought when I saw this. I thought, why isn't anyone talking to this patient and their families about this? And then I saw the notes that led up to the palliative care referral. They said stuff like, patient doesn't want to be in the hospital, patient doesn't want surgery to fix their foot, patient has necrotic tissue, which means dead tissue, which does, if you don't have an operation to take off the dead tissue, it will eventually become gangrenous and have you have chronic infections and lead to death, right? So this is all happening in the chart, but I also didn't see any conversations with the patient and family about what was truly happening, which was, this was an elderly person in their late 90s who's likely towards the end of their life because of this dead tissue that they do not want removed, which again, to me is like the right choice because they probably wouldn't even be able to survive surgery anyway. But there was nowhere in the chart that they had a conversation with the family about what was actually happening, which was this person is at the end of their life. So I thought, oh man, I have my work cut out for me. But I like talking about this stuff and it's okay. So I didn't mind. I was just sort of like, man, I wonder what I'm going to run into when I go to this house, right? So I get there and of course the family's amazing, the patient's amazing, but I could tell they were at the end of their life. One, even if you were in picture perfect health, if you're in your late 90s, you're at the end of your life, most likely. At least within a few years, you're likely not going to live another 10 years, right? So I thought, you know what? I don't know if anyone has talked to this family and the patient about what's going on, but I am going to. So I sat everybody down and I said my little spiel, which I usually start out with like, listen, everyone has an end of life journey. Everyone, all of us are going to. Now you're in your late 90s, so even if you were in picture perfect health, you are near your end of life journey. We know you're going there, right? And everyone there, including the patient, is going like, yes, I know that. There's a few laughs. The patient's like, yes, I know. Usually when someone's in their late 90s, they're kind of like ready to go. So this patient was kind of acting like that. And then I said, and on top of that, you're not in picture perfect health, right? You have this foot issue where you have dead tissue, you don't want the surgery, nor would you probably be a surgical candidate. So this is going to be an issue for you, and this is going to eventually probably cause the end of your life. To my surprise, or not really to my surprise, everyone there understood. No one there was shocked that I said that. The patient wasn't shocked. The family was like, everyone's nodding their head along, right? And I said, so now that you know that, what would you want? What do you want? Do you want to go back to the hospital if something happens? If your heart stops, do you want us to do CPR to bring you back? And of course, the patient right away, no, oh my God, like concerned. No. I do not want to go back to the hospital. I never wanted to go back. That's the whole reason why I'm here anyway. I don't want to be brought back. I want to die naturally in the home. The family is like nodding along. Yes, of course, that's what we want. But no one had even told them that, well, that's not what the chart says. The chart says that you're full code, that no one spoke to you about this. So the family was like, oh no, that's not what we want. So we changed it right then and there. They didn't actually go on to palliative care. They ended up going on to hospice because they are more appropriate for hospice and willing to go on hospice. And we had a long conversation about, what were the next steps? How can we keep this person comfortable? What does hospice mean? How can we help them? Organizing their funeral plans, which by the way, they already had planned out. Thank you very much. And just talking to the family about how to care for their loved one now that we all are on the same page about them wanting to be home and being comfortable and to die peacefully and naturally, whenever that may be, in the home. This is why I love my job. I leave that house thinking like, yes. Imagine if, and this isn't about like praising me, this is just about educating people about the importance of talking about end of life and not being afraid to bring it up. Because imagine if I read that chart, because I could have read that chart even as a palliative care and a hospice nurse and thought, oh wow, they must be really adamant about, not talking about end of life because it's nowhere in the chart. They're in their late 90s in full code. And I could have gone there with this mindset of like, I'm not going to bring it up. Clearly they don't want to talk about it. Because I have been that person before where like I've made assumptions, right? But instead I went there being willing to have the difficult conversations, and look what happened. I truly feel like that patient now is set up to have a beautiful, natural end of life journey versus one where the family doesn't know their end of life. The family sees them, not waking up, being more lethargic, so they call 911. The paramedics see that they're full code, so they take them to the hospital. The chart says they're full code, so now they're doing CPR if their heart stops. And then that kind of stuff happens all the time. I saw it all the time as a nurse in the hospital. This is why, I love my job. I loved that day, seeing how, because we were all willing to openly talk about the end of life, this person's life has changed. They will now gradually and naturally die peacefully at home with their loved ones who are now prepared. It still can be sad. It still can be hard. There's still going to be things that we have to do, like manage their pain and make sure they're comfortable. But I feel like that's so much better than the alternative of just not talking about it or just assuming that they want what the chart says they want. So it's that ability to talk about end of life that can really help shift perspectives. Shift my perspective as the healthcare worker, right? I was open-minded enough to be like, maybe this isn't what they want, and maybe I can be willing to just ask them, right? And luckily this family was very open and very like, oh no, that's not what we want. We are open to what you're saying, what you're talking about. Now, not every family will be like that, and that's okay too. These conversations can be messy because they need to be had. I'd rather them be had and be messy than not had at all. Conversations like this can shift my perspective, shift the patient's perspective, the family's perspective, and even if in that first conversation things don't go well, it at least opens the door for the conversation to happen. So the emotional benefits that come with this conversation is that the patient starts seeing that it's okay to talk about these hard, difficult, emotional things with their family, right? And then the healthcare worker is able to answer some of the scary questions that they might have amongst each other. And all of this helps reduce fear. When we reduce fear, we live better, like I always say, and we die better. All of these things can really help foster communication within the family, good relationships within the family all being there, hearing what everyone wants, so there's not like one person blaming the other person. It's just a good way to really open up the whole dynamic within a family. And lastly, this gives the patient and the family control over something that is so out of control. The end of life can make you feel so out of control. You don't have a control over the fact that you're losing your loved one, that they're going to die. But helping them see and know what to expect can help them feel like there is some control. I have control over how this is going to look, what we're going to do, how I'm going to care for my loved one at the end of their life, how I can help them have the end of life that they want. That gives them some form of control back, which is always a good feeling.